Hey guys, it's Dr. Childs. Today I want to talk about high testosterone and specifically I want to talk about high testosterone in women. And then also what we're going to do is we're going to talk about what you can do to lower these levels if you find that your symptoms are coincide with the symptoms of high testosterone, etc. So first of all, high testosterone is actually quite common in women, and we'll talk about the reason for this. And a lot of it has to do with some of the hormone imbalances that precipitate high testosterone levels in women. They're also just very common among well, actually, just among everyone in the United States, both men and women. But you may have high testosterone and not even realize it because testosterone is just not something that most physicians check regularly in a woman, unless, of course, they present with some of the more common symptoms, which would be male pattern baldness or coarse dark hair growth on the face, etc. Like those cosmetic changes, a woman will notice and she will go to the doctor and say, hey, this is not right immediately. But there are some more sinister and more less specific symptoms that we're going to talk about right now. So number one, believe it or not, is weight gain or the inability to lose weight, especially if the weight is unexpected or occurs around your menstrual cycle or some other hormone or some other time when hormones are known to change. Okay, so weight gain is a big one. The second one is hair loss. So not only can women get hair growth if they have high testosterone, but that hair growth is generally in the places that a male would get it. So it might be coarse dark hair on the chin or coarse dark hair in the area above the under the nose and above the lip, the upper lip area. So hair growth is a symptom, but also hair loss. And specifically if it's hair loss, it's going to be in the male pattern area. So you can kind of see here that the woman, it will be thinning on the crown, the hairline will recede. I mean, it is very similar to the male pattern that occurs. So that's one. And again, this one's cosmetic, so most women don't let this one go. Another big one is acne or changes to complexion or a change in terms of how much oil the skin is producing. So testosterone, which is why a lot of younger males, they end up with very deep cystic acne as a result of the oil production in the skin. Okay, and so specifically, I would say the majority of the time, if a woman has higher testosterone levels, the acne that she tends to get are those deep cystic acne, and that are along the chin line generally, and so that's more of a hormonal pattern of acne. Now that's not 100%, I understand that, but generally speaking, the deep cystic acne tends to be associated with high androgen levels, which is testosterone and DHEA, which we will talk about a little bit later. Then of course, changes in mood, depression, irritability, or anger, they tend to be more on that side of things. Occasionally anxiety can be lumped in there, but it's more of just not feeling like yourself. It's quick it's if someone you're easily annoyed, I guess would be a way to put this. And then you also tend to be a little bit down. So testosterone obviously affects your mood as it does in men and women, and so that's why that can happen. And then another thing is a symptom of high testosterone is changes to other hormones. Okay, so that would be estrogen and progesterone, or the estrogen-progesterone ratio, in addition to other androgens, cortisol, thyroid hormone, etc. And we're going to talk about how all of this kind of plays together. But the important thing is these are symptoms associated with high testosterone. Okay, so how do you know if you have high testosterone? It actually is quite easy to test for those levels. Now, when I say it's easy, I mean it's not a difficult test to interpret, whereas thyroid studies and some of the other hormones can be kind of difficult. Now, testosterone, it has nuances, but it's not as difficult as those. Now, having said that, most physicians may not order these tests, so you may have to ask or suggest that they check your testosterone levels. And what I mean by testosterone levels is both your free and total testosterone, your sex hormone binding globulin, and then of course you want to check some of the other ones like estrogen and progesterone just to get an idea of what's happening. But it's somewhat straightforward. So let me use this as an example here. So this is a patient with high testosterone levels. She had all the symptoms that we discussed, well, not all of them, but she had several of those symptoms that we discussed above, and you can see here. So if you look here, this is the testosterone. This is, if it doesn't say free next to it, then you can assume that it's the total testosterone usually, if it's coming from the blood, okay? So this is the total testosterone. And her value is 71, and you can look here, the reference range is 14 to 76. Okay, and this is nanograms per deciliter. And now here's the free testosterone, and this is where things get kind of interesting. So her free testosterone is 0.127. Okay, it was marked as and flagged as high, and the reference range is 0.1 to 0.85. So her free testosterone is quite high, above the reference range, so it'll be flagged and no one can miss that. But what's interesting is that her total testosterone wasn't marked as high, okay? Now, if you look at this, now look at the reference range here, 14 to 76. So I mean, there's not a big difference between 71 and 77. And if she was 77, yeah, it'd be marked as flagged or be flagged as high. But what I'm trying to get here is that much like other hormones like thyroid hormone, there's an optimal range to be in. And women tend to be very sensitive to subtle and slight changes in hormone levels. And it results in or manifests as symptoms in their entire body when these are dysregulated. But what I want to focus in on here is this 71 is at the higher end. So she's probably, top 95th percentile of the total testosterone. And then of course the free testosterone is quite high. So, and this is a pattern I see a lot, and this is why I wanted to show you this specific example. So in fact, many women may even have normal or mid-range total testosterones, but almost everyone who has high or the symptoms of high testosterone, they will almost always have a very high normal or just frankly elevated free testosterone. And it's important because free testosterone is the active component of the testosterone that's in your body, okay? So this total testosterone is not actually active. You can think of it kind of as a reservoir versus the free testosterone is out there. It's activating to the androgen receptors. It's getting into the cells. It's causing all of the mayhem that we just described in the symptoms. So, in terms of on the skin tissue, it will get on the cells and it will cause the production of oil to increase, etc., right? It will get in the hair follicles themselves. It will cause them to recede. It will cause them to darken, etc. So this is all done by free testosterone. So yes, total testosterone is important, but free testosterone is kind of where the money's at, okay? Here's another example of one that's, again, this one's a little bit trickier, so you can see another good example. I'm showing you these just so you can compare your own labs, okay? So this total testosterone is 51. Again, kind of in the mid-range. Yeah, it's a little bit higher, in the top 50 percentile, but not crazy high, so 14 to 76 again. But look at the free. The free is 0.89. And the reference range goes to 0.85 in this. I think the other one was 0.86. Oh, no, it was 0.85 as well. These are different labs, but these reference ranges are the same. But anyway, you can see here that this 0.89 is elevated. This actually wasn't even marked as flagged as high, but she, again, had all those symptoms. So you really want to hone in and zero in on that free testosterone level. So again, like I said, it's pretty straightforward. You can also check your DHEA levels. I don't think I have an example of that in the high range, but I do in the low range. And your DHEA, like testosterone, is just another androgen. And I'm going to talk to you about the other ones that you can look at and test. But in general, the easiest way to do it is to look at free and total testosterone and then DHEA levels. And you'll at least get 80-90% of the picture just doing that. Now this should be differentiated obviously from low testosterone, and again that one's a little more nuanced but generally pretty easy. So here's an example of a woman who's postmenopausal. Her total testosterone is off the charts low, and her DHEA is off the charts low as well. And if you look at women over time, assuming they don't have any of the hormone imbalances and the causes that we're going to be discussing below, most women will develop low testosterone as they age. And that's just the same thing with men generally, not always. I understand there's always exceptions, but generally speaking, the way that hormones progress over time is that they lower over time. And so most women, generally what you might see is something like high testosterone in a premenopausal woman, meaning a woman that's menstruating, and then somebody with high testosterone may have also the signs and symptoms of PCOS, or they may fall on that sort of spectrum there. And then as they get older, they may retain some of those symptoms, but then all their hormones begin to fall. So they kind of get hit with a double whammy. And the reason that the scale tips has to do with menopause, which is the change in the other sex hormones and how that interacts with testosterone levels, which again, like I said, we will talk about that below. So let's talk about the specific causes, and we'll go into a little more detail and explain those, because really knowing that you have high testosterone is important, but not if you're not going to treat it, okay? And so that's where things can get a little bit tricky. And I think this is why a lot of women end up seeking this kind of information, because if you take high testosterone to your doctor, they may put you on something like spironolactone, maybe if they even know about it, which can alter some of those the effects on the skin and such. But otherwise, there's not too many treatments for women. They may try and put you on birth control, etc. But the treatment is more of just masking the problem. It's not actually treating the issue. So let's talk about what are those underlying causes, and then how can you treat those issues. Okay, so number one, this is by far the most common reason for high testosterone in women, and it is insulin resistance. Okay, and now this, some of you might get confused because you may know that insulin resistance can actually cause low testosterone also, okay? Now, and I've seen this in different subgroups of women. The reason why some women, when in the presence of insulin, have high testosterone and others have low, no one really knows. But what'll happen is this, generally speaking. Insulin levels elevate due to a bunch of other factors, which we'll talk about, and testosterone will either go up or it'll either go down. Now, generally, the women who tend to have lower testosterone, those tend to be the women that develop autoimmune diseases such as Hashimoto's thyroiditis and other things. And the women who have higher testosterone, they are the ones that tend to get the PCOS type of symptoms. So PMS, PMDD, all of the other high testosterone symptoms we talked about. So it's kind of like a fork in the road. And since I would say, well, I don't have to say this, it's been shown in studies, but about 50% of the US population has prediabetes or diabetes or some degree of insulin resistance, which means that there's a 1 in 2 chance, if you're listening to this in a woman, that you have insulin resistance in your body. Now the question is not do you have it, more so how is it affecting your body? Okay. So I'm going to ignore the low insulin, or I'm going to ignore the fact that insulin resistance can cause low testosterone in some women, and actually it happens a lot in males, and just focus on how insulin resistance can cause high testosterone in a subset of patients. So again, this is another relatively easy one to check. You can just check a fasting insulin level. It should be less than 5. Now, don't let this range confuse you, because insulin levels fluctuate wildly throughout the day. If you eat a meal and check your insulin, it's going to be a lot higher. If you're fasting, though, that's a pretty good way to assess. And generally, if there's no food in your body, your insulin should be quite low. If there's no food in your body, your insulin is quite high, that's an abnormal response, and that's usually an indication that insulin resistance is present. So I say check your fasting insulin first, because it's relatively easy and effective, and you have to fast for your blood test anyway, so you might as well check it. Now I will tell you this, and I'm bringing this up because again, it's getting a little more nuanced than I like to get in these videos, but I've had questions from other patients on this post, and they say this. They say, well, I checked my fasting insulin and it's fine, so that's not the cause of my high testosterone. Actually, that's not true at all. There's a lot of patients who have insulin resistance but normal fasting insulin levels. There are even diabetics, type 2 diabetics, who have normal fasting insulin levels, but their postprandial insulin levels are sky high. So while fasting insulin is helpful, it's not the end-all be-all in terms of diagnosis of insulin resistance. The absolute best test, as far as I know, is a 2-hour postprandial insulin level. That means you have a meal that's high in glucose. You check your postprandial insulin level. It should be less than 30. If it's anything higher than that, you've got insulin resistance. Okay. So there's 2 ways you might have to go about doing this. You can also check the hemoglobin A1C. Obviously, if you're pre-diabetic, which is a hemoglobin A1C of 5.7 or higher, then you can pretty much say right there that insulin resistance is one of your issues. Okay. But anyway, insulin resistance, huge, huge, huge. You really need, if you have the symptoms or any of these other things I've been talking about, get your fasting insulin checked, get your hemoglobin A1C checked, get your blood sugar checked. If you've ever been told you're pre-diabetic, you have high blood sugar, or your blood sugar needs to be maintained, or anything like that, that's probably your cause, okay? And I have lots of resources on how to treat that. In fact, a lot of it you can do at home with supplements, dietary changes, intermittent fasting, etc. I'm not going to talk about that right now. We'll talk about it a little bit later. The second cause of high testosterone in women is imbalances in the estrogen-progesterone ratio. Okay, and this constellation of conditions is known as the estrogen dominance conditions, right? So that includes PMS, PMDD, fibrocystic breast disease, endometriosis, etc., etc., etc. Now the point here is not to focus on those specifically, but to just point out that all of your hormones are related, and so you can't look at your body and just pull one string and suppose that nothing else is going to be affected. So if you have estrogen and progesterone imbalances, you're going to also have testosterone imbalances, also thyroid, also cortisol, etc. So, but these imbalances by themselves have been associated with high DHEA levels and testosterone, and you can see links to the studies that I'm referencing here. Third reason is lack of exercise, especially weight training. Okay, so the etiology of this, meaning why does it cause high testosterone, is not 100% clear, but it probably has to do with the fact that exercise helps to lower insulin levels. So this is probably a roundabout way getting back up to number 1 here, which means if you don't exercise, your muscle cells are not going to be as high, your metabolism is going to be lower, you're going to have more weight gain, you're going to have more insulin resistance, etc. So exercise, you need to be doing it, specifically weight training. Okay. Another one that's actually quite common is adrenal disease. Okay, and I'm not talking about adrenal fatigue or anything like that. I'm talking about high DHEA levels. So there's some congenital issues. There's also some enzymatic issues. But basically, what happens is this: DHEA, and you can look in this, use this diagram to help you understand this. But this is the cholesterol synthesis in the adrenal gland and how all these hormones kind of fit together. But you can see here, if we want to start from the top, cholesterol is required for all of these things, right? But cholesterol goes to pregnenolone, which then goes to DHEA. Okay, now DHEA is an androgen. And that means that it sits on the androgen receptors in your body. So it will cause some of these symptoms potentially that we're talking about. It's not the most powerful androgen, but it is an androgen nonetheless. Okay, but here's where things get interesting. DHEA is a precursor to testosterone. Okay, so if you have high DHEA levels, or if you're taking DHEA, the supplement, your body may turn that DHEA into testosterone. Okay, this is why some women, when they take DHEA supplements, they may get the symptoms of high testosterone because they're giving their body the direct precursor. Now, yes, you can actually get back over to estrone metabolites, which is an estrogen, sits on the estrogen receptor. So taking DHEA may not actually result in high testosterone. It may actually result in high estrogen levels. So I'm not. We'll have to talk about that a little bit later. But the point is here is that high DHEA levels can result in high testosterone levels, and a lot of this has to do with these enzymes which catalyze these reactions. So if you have alterations in these enzyme levels, or one's functioning more than the other, or if you just produce high DHEA naturally due to a number of other reasons, congenital or otherwise, then you may have higher testosterone levels. Okay, so adrenal problems, big thing. You need to talk about that. I include some of them here. So adrenal hyperplasia, high stress, or adrenal or high demand on the adrenal function, excess supplementation of progesterone, pregnenolone, or DHEA, right? Because they're all involved in this pathway. So pregnenolone's over here. You can take pregnenolone as a supplement over the counter. You can take DHEA as a supplement over the counter. So guess what? If you provide yourself with these precursors, your body may say, oh, I love this. I'm going to turn my pregnenolone into DHEA and then down to testosterone. You just don't know for sure. Another big one, another big cause that I think one of the last ones here is high leptin levels, otherwise known as leptin resistance. Okay, so leptin resistance directly is associated with high testosterone levels. It's been shown high leptin levels are seen in women with PCOS. I mean, the connection there is strong, and it's well studied in the literature. It's also connected to high insulin, right? So hopefully you're getting a picture here where you're seeing how everything kind of fits together. High insulin levels equates to higher leptin levels, which equates to high testosterone levels. High insulin by itself also equals high testosterone levels. Sedentary lifestyle or lack of exercise or weight gain causes all of these things as well. So it's really all interconnected, which brings us to our last one here, which is weight gain by itself or just being overweight in general. Changes can alter the enzyme level 17 beta hydroxysteroid dehydrogenase type 5, which is a mouthful. But again, the point is that can result in increased androgens in the body just by having excess fat on your body. Okay, so this is again one of those conditions where, you know, a lot of the reasons that or a lot of the issues with being overweight is the secondary effects, meaning, you know, your weight gain occurred because of or issues in your biochemistry, but the fat itself can also be inflammatory. It can also upregulate or downregulate enzymes. It can also secrete leptin. So fat having overweight and fat in your body is a problem, but also having the change in biochemistry, which results in weight gain, is also a problem. But those are two separate things. But in this one, I'm talking specifically about just having excess weight on your body. So the big question is, what do you do about it? So the way you want to approach this is first of all, you have to know what caused it in your body. You can't just, you know, I guess you could just take some of these supplements, and I guess you could do that. It wouldn't be the best way to do it, though. You really want to focus in on what is the cause, because that's going to get you the best results. So assuming you understand and you went through some of the other tests that I talk about, now you can kind of treat the issue that you have at hand. Now, since insulin resistance is the most common, and most women, if they have high testosterone, probably have also been told they have high blood sugar or something like that. They usually know if they have insulin resistance, usually, not always, but usually. So what do? I have a full list here. There's even more than this, believe it or not, but adding in high intensity interval training or weight training, you want to build your skeletal muscle, because the more muscle mass you have, the more sensitive your muscle is to insulin, which makes your insulin levels more effective, which can drop your insulin long term. Obviously, you want to decrease your carbohydrate, but especially refined carbs, bread, sugars, pasta, cereals, etc. You do not want to be eating anything like that, because it'll directly stimulate it. I will tell you right now that just the reduction in your dietary carbohydrate is insufficient to reverse most causes of insulin resistance in the body. So yeah, I know that may seem like a shock to many of you, because you probably think that it's a dietary disease, and it is, but a lot of other things propagate and potentiate the insulin levels once they're elevated. So just cutting out that input of refined carbohydrates is not enough by itself. Usually, I'd say about 50% of the time, to completely drop those insulin levels. You can consider diets like nutritional ketosis, etc. Consider the use of T3 hormone supplementation, which directly sensitizes your cells and tissues to insulin. There are some very specific medications that I do recommend, especially if you are a woman suffering from these things. That would be the class of SGLT2 inhibitors, which is pretty awesome at reducing insulin levels. Metformin's an okay one. GLP-1 agonists, again, really, really good. And then alpha amylase inhibitors. So your doctor should know about some of these things, and with the exception of the GLP-1 and the SGLT2 inhibitors, the metformin and the alpha amylase inhibitors are quite cheap, so they should be, I think, about 20-30 bucks, I'd want to say. Per month. So you can use these medications. And then, of course, supplementation. So many of these supplements actually work quite well. So berberine being one, alpha lipoic acid being another. Probably berberine, alpha lipoic acid, and chromium are probably my top three that I use the most. Berberine in some studies has been shown to be as effective as metformin at reducing hemoglobin A1C. Alpha lipoic acid, powerful anti-inflammatory agent. Really good at lowering insulin levels as well. Magnesium's another good one. Chromium's another good one. And then, of course, PGX fiber, which basically absorbs it basically delays the absorption of sugar into your body or carbohydrate into your body, which will necessarily reduce the wild rise or robust rise in insulin levels that occurs postprandial or after a meal. Okay. Now, I believe put a caveat in here. So now I've given you multiple options here. Now, the worst thing that you could probably do is just say, oh, I'm just going to take berberine and alpha lipoic acid and chromium because he told me to. I mean, yes, you can take those, but you really want to do all of these things as if you can, right? So the more things you do, the more effective the treatment will be. That's pretty straightforward. That should not sound as a surprise, or that should not come as a surprise to you. Next thing you want to do is, assuming you have estrogen and progesterone imbalances, if you have PMS, PMDD, fibrocystic breast disease, endometriosis, etc., then you want to make sure that you address those as well. Okay, so now we're going to talk about how to do that, but you want to make sure that your thyroid is functioning optimally because hypothyroidism leads to estrogen dominance and low progesterone. Okay, you want to make sure that your excretion and metabolism of estrogen is optimal, and what I mean by that is when you have too much estrogen in your body, your liver is the primary way that it eliminates it, and it does that through the phase 1 and phase 2 elimination pathways. So you can actually upregulate those pathways and get rid of that excess estrogen in your body. So you may not be able to directly reduce the amount that you're producing, but you can increase the amount that you're getting rid of it. Okay, so there's two inputs, right? The amount that you're putting in and the amount that you're getting rid of it. And in this case, I'm talking about increasing the amount you're getting rid of. Okay, if you're menopausal, you can consider using bioidentical hormone replacement. Specifically, I'm talking about progesterone here because, again, if estradiol levels are high, progesterone levels are usually going to be low in this setting, which means you can supplement with the use of progesterone as a bioidentical hormone. You can also consider other supplements to help with estrogen metabolism. So vitamin B12, preferably methylated. I recommend B12 shots, but you can use sublingual as well. I just think, I'll just be honest with you, sublingual is inferior to B12 shots in my opinion. You can use diindolylmethane or indole-3-carbinol. Those both upregulate the metabolism of estrogen into the less estrogenic metabolites, meaning they're not quite as powerful as the other metabolites, which is good. That's a good thing. You want that to happen. And indole-3-carbinol is the one of the active ingredient, or well, it's one of the nutrients that's found in cruciferous vegetables. So that's why you might have heard somewhere that somebody says to eat a bunch of broccoli or cabbage or whatever if you have estrogen dominant symptoms. This is why. Okay, milk thistle or MSM will of course help with clear out the liver. It'll help improve liver function, metabolism, etc. And then of course bioidentical progesterone, 20 to 40 milligrams transdermally if you're cycling on days 14 to 28. If you're not cycling, then that's a little bit different. That would be meaning you're postmenopausal or had a hysterectomy or something like that. You can check for these things. I'm not going to talk about that too much because it's already getting a little bit lengthy, but you want to use a Dutch urine test because that's the best way to look for those estrogen metabolites we talked about. If it's related to adrenal related issues, here's a whole list of things that I'm giving you that you can do. Again, a lot of things here. You want to increase your consumption of salt, preferably Himalayan pink salt or Celtic sea salt. Manage your stress levels, has to happen. Cut caffeine and alcohol consumption. You cannot be reliant upon caffeine as an energy source. That will not help. You want to cut other stimulants as well. So amphetamine-based medications, Adderall, Concerta, phentermine, etc. You want to get rid of those. You have to be getting 8 hours of sleep per night. Obviously, you want to avoid any high energy tasks at night because that's generally when patients with adrenal issues get their second wind. They're fatigued in the entire day, and then all of a sudden, it's 10 p.m. and they're boom, wide awake. That's not a good thing. You don't want to do that. You can consider all of these supplements. So adrenal adaptogens, adrenal glandulars, B6, vitamin C, and low dose melatonin. So I generally will recommend these to most, at least some combination of these, really depending on what their issues are, to most of my patients. In addition, you can listen to these kind of these are audio clips that can help sort of relax the brain and kind of help you get into sleep, get you into a meditative zone, and kind of slow down the body a little bit. Again, adrenal issues can be complex, so this is kind of a cursory overview of what you can do. And then I think the last one here that we want to talk about is leptin resistance. This one is a little bit trickier to treat because not many people know about it. Now, I have lots of case studies that you can and resources on my site that you can look at about leptin resistance because it's pretty common. I'd say probably 40% of people that I treat have it. And it's becoming more and more common as more and more people continue to do those crazy diets and such. But anyway, to treat leptin resistance, you'll want to consider an intermittent fasting program. You want to cut carbohydrates and fructose consumption, but you also want to make sure that your protein level is not too high because protein directly stimulates leptin levels. You want to treat thyroid resistance because most patients with leptin resistance have low T3 levels. They usually do best on T3 supplementation. You want to add in a high-intensity exercise, of course, weight training preferably. There are some leptin-sensitizing medications which are in the class of GLP-1 agonists with the exception of Simlin. So Victoza, Bydureon, Trulicity, those are medications that might help. And then Simlin's kind of in its own class. It's an amylin agonist, but it can work as well. And then, of course, supplementation. So there's no specific supplements for leptin, but fish oil, zinc, and leucine, they can actually help. And I have a whole article about leptin supplements as well. So that was kind of a lot of information, I realize, but we're trying to cover a lot of ground here. So this is a big deal for a lot of women, and so I think you should definitely take it seriously if you feel that you have high testosterone. Don't ignore it, and then address. First of all, the bottom line is you have to figure out what is causing your high testosterone, and then once you do that, then you can treat it, and you'll be a lot better off for that. So if you have any questions, I know it's a complex topic. Please, leave them below. Go to my site. You can post a comment or post it on wherever you're reading this or listening to it, and I'll try to get back to you. But anyways, I hope you guys found this helpful, and otherwise, I'll talk to you guys soon.